go back to China, guys, and focusing on what's happening there, and Germany, by the way, where they're taking steps now to end the lockdown going on there, that they're moving too quickly. Now, China can argue, well, we were the first on earth to deal with this months ago, so now is the time to tell our people, you can get out of your homes, you can go visit public sites like the Wall and what have you, even return to shopping and your jobs. You think all of that is happening too soon?
Well, look, we don't really know enough about the virus, right? I mean, this case is about asymptomatic individuals. We don't know how that can actually reignite a new wave. And in fact, even though they were at a different pace, right? I mean, we don't really know what prevention measures they're putting in place to mitigate those social environments where they're allowing large group gatherings. In addition, they're at a much different pace. The United States is at a much different pace. So looking to them for information, what measures they're putting in place, how are they flattening the curve will be really critical as we move forward and get at that apex, which we are at right now, to flatten the curve.
When we reach an apex, it's supposedly the high. For those of you looking at home, even though we're talking about China, we are showing London right now. This is where Boris Johnson is being treated in intensive care at a London hospital for the fallout from coronavirus, for which he tested positive 2 weeks ago. But it's escalating in a country like Britain, in a country like so much of the world that has been under these quasi-lockdown provisions. I think, Doctor, 6 out of 10 people on this planet are under some sort of a stay-at-home provision. 9 out of 10 Americans. How long do you suspect all that goes on?
Look, we don't know, and that's ultimately the question on everybody's mind. How long will this last? But there is some favorable data that came out of New York today. We're beginning to see the flattening of the curve. This is better, but it's better at least. We still need to do much, much more on prevention. We still need to focus on cautionary measures such as social distancing, the hand washing, and we still need to discuss about helping our healthcare providers that are at the front line that need prevention, protective equipment. There's still a lot of work ahead. And I think that even though the numbers are beginning to flatten, there are areas that are continuing to rise. So there's a lot more that we need to continue to do. We have to continue to talk about prevention. We need to protect our citizens. And we do need to think positively. Even though the numbers are beginning to flatten, we still need to maintain a positive outlook that we can overcome this, that we are still going to do everything we can to help our public citizens as a U.S. government, but at the same time, we need to continue to focus on everything that we can do to control this.
Doctor, thank you very, very much. Dr. Anita Gupta, the doctor hit a key point that's going to be debated rather forcefully over the next few weeks when our own stay-at-home provisions are going to be revisited at the end of this month. At what point do you go ahead and let people ease up on these sheltering provisions? Do you do it when the number of cases and the increase of them is ebbing, or are they just reversing?